This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. If you are producing eggs and you do get to blastocyst, then, as I said before, it is a numbers game. If you get to a day 5 embryo and it's got a 1 in 10 chance of producing a baby, then doing 10 cycles ought to work in your favour. But 10 cycles is quite a burden, both financially and emotionally. It's hard to go that far. I have had the occasional patient who has gone on that far and has been successful. When we do get embryos in women in their 40s, particularly if it's more than one embryo, I do encourage them to get genetic testing on the embryo before we put it back. It means you know where you are, and if they are all genetically abnormal, you've saved yourself the heartache of having embryo after embryo put back when they were already doomed. The alternative is to just put them back and hope. Once we test an embryo with genetic testing and it turns out to be normal, your odds suddenly go from 10% to 50 to 60% with one embryo transfer, because we're getting rid of the major reasons why IVF doesn't work in older women, i.e. the genetic problems with the embryo. So if you are lucky at the age of 42, 43, and you are getting embryos, it's certainly worthwhile going to a clinic where they can do that testing for you, because it will help you. So how long do you go on for? And I said already, that's going to be a decision you make. There are, as I said, indications to stop where you get failure of getting to eggs, or failure of eggs dividing and giving you an embryo. If that happens on frequent occasions, then it's time to stop. The move forward in that scenario, if you really want a baby, is to find a young woman to donate eggs to you. In Australia, that's a bit tricky because we don't pay donors, but there are many countries around the world where egg donors are paid and they're happy to have their eggs donated. At our own clinic, Life Fertility Clinics in Sydney, we are offering egg donation. In other words, we bring the eggs in from overseas for you to have them create an embryo for you to put back. It's not inexpensive, but it is the solution to continued, repeated, unsuccessful IVF attempts in your 40s. So I never say give up unless you want to. You've got to reach that conclusion yourself. However, going to a clinic where we accept that women in their 40s who want to have a baby need to have the process gone through, knowing that potentially in 5 or 10 years' time they can never look back and say, I should have tried. And certainly many of my patients talk through that concept. So I'm more than happy to treat you. There are clinics who don't treat patients in the older age groups. There are a couple of reasons for that. Some doctors believe it's wasting Medicare money. Others don't want to do it because of the low pregnancy rates. It may interfere with their clinic's league tables that are now available on the internet. But personally, it's not about league tables. It's all about the coming to terms with either having or not having a child. What I want when a patient comes to see me, whatever their age, that when they leave me, they either go away with a baby or at least a satisfaction that they've tried everything possible. And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.